Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together, we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
This is interfering with our flow, Brad.
I know, Bob.
Sorry.
Today, we are most graciously joined by Jody, who's going to be our real patient today, and we're going to talk about dramatic pain relief for rheumatoid arthritis and fibromyalgia. Again, we got a real patient story here. Some of the things that worked for Jody and some of the things that didn't work.
Right. And I think the most amazing thing is she has been, Bob, quit doing that. I'm not going to eat this, Mike.
You nearly gotta.
Is she had some really good success after going through a regimen of things that weren't working that were supposed to, and she does a much better job, so I'm going to let her finish up with that.
Before we do that, though.
Yeah, take that.
Before we do that, though, let's please welcome everybody. If you're new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, if you get a chance, go to the Facebook and like us, because Brad and I, as children, we're not liked. And go to Bob and Brad, and we're trying to turn things around. We actually have a couple people that like us. Now, we actually have a guest that came in, so that's a good sign, right?
Yeah.
So, all right, Jody, do you want to just start talking?
I'd like to, thank you. In about 2013, I was diagnosed with fibromyalgia, and they did a rheumatoid arthritis test at the same time. Didn't think I had it, and it came back with extremely high indicators. So what happens usually when you're diagnosed with RA is they put you on 2 drugs usually to start. One actually is a cancer drug, a chemotherapy drug. And the other one is, one's called methotrexate and the other is plaquenil.
Okay.
So you got kind of a double whammy here.
Yeah,
You got, 2 major diagnoses in one setting, so that must have been a little bit of a shock. And, were you suspecting?
No, my husband's an RN, and he has some opinions about fibromyalgia. And
Sure.
So, yeah, it was very shocking and troublesome because it is a progressive, non-curable disease.
Sure. Yep.
So I've had a lot of medical issues in my life and was very accustomed to having doctors tell me what to do, following their instructions, and So that was obviously what we were going to do. The trouble came after I was on methotrexate for about a year, and I didn't know it, but it can affect your liver functions and enzymes.
Gotcha.
So we had a test, and I had to go off of it because my enzymes were up. The other thing that they do usually with RA is they can, for flares, so rheumatoid arthritis is an autoimmune disease, and which
Correct,
basically
yeah.
means your immune system is attacking itself.
Right.
So you can go along and be perfectly okay, and then you'll have a flare, or you can live in a state of flare, I guess. So I had a couple of flares. They put me on steroids. They dropped the flares down because it helps to reduce the inflammation. And then found out.
But you can't, obviously, you can't
can't
stay on
stand
steroids
that.
very
No,
long
no.
at all.
And the other thing
No.
that people take a lot to help with the pain and the inflammation is NSAIDs.
Sure.
So, and that's not good to be on long-term
For
either.
prolonged, right.
So a lot of these things that help manage the disease is not good for your body.
Right, and they sometimes can end up not worse, but they're.
Oh, wait till you
well,
hear.
yeah,
Yes,
so
much worse.
I was
yeah.
going to say some of them do get worse than the cure. Or
So I
worse
had
than
to
the
go
problem.
off the one drug, and when we started this, because certain drugs are advertised a lot out there, they're called biologics for this type of a disease.
Biologics.
Biologics.
Okay.
And I was adamant I was not going to go on one because they have a lot of side effects. However, after 2 years and not being able to take the one drug, I had a really bad flare and basically was convinced by the doctor to go on a biologic, which is an injection every 2 weeks. So I was on that for about 9 months, had several flares, so it was
Despite being on it,
Right.
you're
Right.
still having flares.
The reason that we decided to go on it, though, was because of the concern about long-term joint damage. At the time I was diagnosed, they took x-rays and I had no joint damage. So they wanted to keep
Kinda
that.
stave that off.
Exactly.
Sure.
So I would say in about late summer of 2016, I had a flare that wouldn't go away, and they put me back on steroids for an extended amount of time. That's when my body rebelled, and I developed yeast all over my torso.
Oh, good Lord.
I developed psoriasis and had never had it in my life.
Wow.
I still had my flare. Went to a dermatologist, and they said, until you have this under control, well, I went to my doctor first, obviously, but until you have this under control, we want you off the biologic.
Gotcha.
It took months. They put me on a steroid cream, which then created boils and pustules.
Oh, my gosh. So you can see things are just sliding the wrong way here.
And in the meantime, was the fibromyalgia a factor, or was that kind of in the back burner, or just an irritant along with it?
Well, that's a really good point. It seems they go hand in hand. It seems like when I have a flare of the RA, the fibromyalgia, it's like a whole body thing. And my fibromyalgia manifests itself in different places than the RA. So sometimes it's like at this point in time, I literally would limp out of bed, limp to the kitchen, take my Advil and my prescription pain medicine daily. And it would be hours before I could function, move my fingers. I actually had a handicapped placard because I couldn't walk very well.
Oh, sure. Yeah.
It was awful. And I really, that was my future. That, to me, was...
I'm sure it was not only the future, it was you were expecting it to get worse. I mean, because things are progressive,
Yeah.
so.
Yeah,
So what
and-
did you begin trying? What changed you?
Well, that summer before, I had a really good friend who had some health issues, and she went to a homeopath. And so I went to a homeopath to kind of talk about options, and she informed me that the number one thing that causes inflammation in your body is your diet.
Sure.
So she had me see one of her dietitians, and I will tell you, it scared me to death because I kind of like food.
We all do.
But she educated me on a lot of stuff, and I had been, really watching my weight for years and years and years and doing a lot of low fat, no fat kind of thing, and
Sure.
found out that actually is very not good for a person. So I had some dietary changes I needed to make, but in addition to that, she does tinctures. So these are drops that I put into water, and one's an anti-inflammatory tincture and one's a pain relief.
Gotcha. Yeah.
And
Tincture is
a tincture is just basically something that's
oil.
in liquid. It's not even an oil. It's
Okay.
like a tincture. Well, and I'm not an expert here, so you might want to Google what a tincture is. But basically, it's a way of distilling plant.
So you're doing this with the diet?
Right, and this was like my first step was to go to her. In addition, I had, during the previous 2 years, started massage therapy and acupuncture, which actually did help quite a bit.
Oh, absolutely.
So I was using those in conjunction to going, but when my body rebelled like that, I was like, I've got to do something else. And I made the decision that I would never be back on any RA drugs because of what happened. So I said, I've got to find something else that's going to help me. And so I went to the homeopath and started that regimen. At the same time, I was introduced to essential oils, and my thinking was two-pronged. I need to manage the pain so I could function, because I couldn't work, I couldn't walk, So I need to manage the pain, and then I need to find out the underlying cause and handle that. So the oils absolutely helped my pain, as did the tinctures. And then the diet and the things underneath the inflammation, understanding what's going on in your body is the key, obviously, to solving the issue. And I will tell you that biologics suppress the immune system. And because an autoimmune disease is the immune system kind of going haywire, they suppress it, so it doesn't do that.
So biologics, you're saying the
Biologics that the medical,
medication
the
that
medical,
the doctor was prescribing.
Right. So one of the cautions with that is, you can get sick very easily because your immune system is compromised. So that also is not a great thing. And the analogy that I used earlier was, it's like if you don't address the underlying cause, which is inflammation in your body, it's systemic inflammation, then it's like stepping on a tack and taking an aspirin but not getting off the tack. You're not actually even treating anything other than it's a Band-Aid.
Sure. So then the diet, you start looking into that and doing changes with that?
Yes, and I will tell you, I remember the first week I said to somebody, I haven't taken a Vicodin for a week. I haven't taken an Advil for a week. I mean, everything was what I hadn't taken, you know, how I was increasing my mobility and my feeling. So when I started making changes to the diet, I ended up being pain-free for over 8 months.
Wow. And without medication?
Without
No pain
medication or pain meds. But here's what makes me really sad, and this is why I wanted to come on the show. I really want people to understand, when I went back to my rheumatologist, because you have like 6 months appointments, I said to her, I've been pain-free, I think this was about 4 months. I was very excited. I wanted to tell her what I was doing, and all she said was, I really want you to go back on XYB.
So she did not acknowledge your success through, or question it, or how did you do it?
Nothing, and all I could think of was, you have other patients this could help. And it made me very sad. So I was talking to my chiropractor, and she said, start spreading the word yourself. Get it out there. What did you do? Tell your story.
Oh, this is no surprise to me at all. I've been reading a lot on diet lately, and just the inflammatory process nature of a lot of foods. This does not surprise me at all. I'll tell you, we're going to do another video where you're just going to talk about diet.
Yes.
Is there anything else here that you want to mention that you're using?
Well, one of the things that I had started using was the Dr. Axe collagen or bone broth. When I first went to my dietitian, she said I could make my own homemade bone broth, but I don't do that. So this is very, and this helps. It helps with the inflammation. I would recommend absolutely finding a homeopath, a good massage therapist, a good chiropractor, a good acupuncture. These are all tools that you can use in your arsenal to help manage the pain, but to also reduce the inflammation so that your joint damage is reduced.
So I'm still curious, the big picture of the diet. What did you reduce carbs?
Well, we're gonna do
Oh,
that
we're
on
going to
another
do a
video.
separate.
I know, but
stay
just
tuned.
give me a one sentence thing. Did you know what I'm saying? Did you read? You're not going to tell me.
She's going to leave you hanging.
Everyone else too.
Coconut oil. I use coconut oil now.
Nice.
How's that? Is that
Coconut
a one
oil. That's one thing.
thing?
Yeah.
That's one thing.
All right, folks. Well, we're going to have to. Did we talk about pretty much everything here?
Yeah, the other thing was, very quickly, anything that you use that I mentioned, the essential oils, or be very, very, very careful to make sure you get it from a professional. Big box stores, even a co-op, there's no regulations on, you know, what is in an essential oil, and they've done independent testing, and some of them have like nothing in them.
I've heard the same thing, actually.
So if you're going to go a natural route, which I totally recommend, find a practitioner that can guide you into what
Someone that you can trust.
Right, exactly.
So, all right. Well, you're going to have to stay tuned for the next video, because that's where we're going to get into the meat and potatoes of what you should be eating. So I want to thank Jody, our guest, for coming
Thank you for having me.
for sharing her knowledge. And we'll see you on the next video. We'll try to put a link to it. So thanks.